I want to get some shots of those mountains if you can.
Well, welcome to the Crisis Jam. I'm here with Representative Steve Elison, and we're going to chit-chat during the pre-show, give people a sense of Salt Lake City and where we're at. We're about 7 miles south of downtown, which is which road?
This way.
So that's downtown. The road home is right there. 300 beds from men's shelter.
Men's homeless shelter, men's resource. Correct. Yeah. And right over here, below those beautiful snow-capped mountains, we have actually the largest jail in the state, the Salt Lake County Jail. And then right behind us, we have a PSAP with the Valley Communications for all of the 911 calls, basically Salt Lake County.
Steve, there's a Avery Nature Center right here. Do you know what is the bird that people like to see there the most?
That's a good question. I'm gonna let my bias shine through and say the bald eagle. So
They may, but they have peacocks.
oh, okay, yeah. Our state bird is the seagull,
The seagull.
California gull, actually. So they probably have some of those flying overhead.
Now, on the other side of the park is the Jordan River.
Yeah, George
which
River
runs from Provo. And
connects the Utah Lake to the Great Salt Lake, freshwater lake to saltwater.
So I have an over-under question for our audience to start. The ocean is 3.5% salt. I didn't know. But Salt Lake, which is a terminal lake, there is no outlets, it is what percentage salt, Steve? So you give a number and our audience will let us know whether they think it's more or less than that. The ocean.
All right. I'm going to go with 8%.
8%. Audience, is the Great Salt Lake more or less than 8% salt? It actually varies from 7 to as much as 25%.
Okay.
Have you ever been in it? Because I hear
yes,
it can
yes,
float.
I have. I've been out there and collected brine shrimp to feed to my tropical fish.
So there are no fish in the lake,
Correct.
but there are shrimp
Brine shrimp.
and
Brine flies. Yeah, a lot of them.
a lot of brine
But
flies.
we have a lot of fabulous birds. It's part of the Pacific Flyway.
Okay.
So we'll have pelicans and all sorts of birds. that
Egrets.
nest. Yep, that
Yeah.
nest and use this as part of their migratory pathway.
So what do they use that Salt Lake? I guess they make gourmet salt and de-icing salt for roads.
Yeah, lithium.
Lithium.
Mhm.
Yeah.
But probably the biggest thing is brine shrimp eggs that are then shipped to Asia, hatched and fed for prawns to create shrimp in the supermarket. So
Wow. So Steve, I have an either or. We're going to ask each of our guests today an either or. What's your favorite? So what's your favorite, Representative Steve Elison, is or snowbird?
that's easy. Snowbird.
Snowbird, come
Yeah.
on.
And we could almost, if we were just a little bit further south, the peaks there to the furthest left, snowbird is just behind those.
Yeah.
So yeah.
So we have a clip that we're going to show right now. Steve, let the audience know what they're seeing.
Okay. Well, you asked me, are those the mountains we ski in? And I told you, yes, I was there just this past weekend and I showed you a little clip and you said, send it to me. So that's me, not in the best form, but Utah is known as the greatest snow on earth. And we also have the 2034 Winter Olympics coming here. We have the 2002 games. So we're starting to plan for those, that exciting worldwide event.
Yeah.
I won't be participating in them as an athlete, but as a spectator.
And of course, this is the worldwide headquarters of the Church of Jesus Christ of Latter-day Saints.
Yes.
Brigham Young founded the city with Mormon pioneers in 1870.
1847. I finally got you on some trivia, David. Yes.
You did give it.
July 24th, 1847, they rolled into the valley, the pioneers did, and that's now a state holiday called Pioneer Day.
Pioneer Day. Steve, the other thing I wanted to ask you was, let's see. Well, let's do this. The Crisis Care Center here is going to serve. Brian Hepburn was talking to Pam Bennett, assistant director with substance use and mental health. She said, incredible facility, going to be the way that crisis care is delivered to a third of Utahns.
Yes.
So how many Utahns are there and how many are here in Salt Lake County?
There's approximately 3.4 million Utahns, about 1% of the nation's population. And Salt Lake County, which we're in, is the largest county with about 1.3 million people. And this will be the premier crisis center for Salt Lake County. And we'll probably pull from along the Wasatch Front from other counties also.
What have we not situated around Salt Lake that we should be talking about so far?
If you haven't been here to visit yet, if you wait, you'll just be 1 year older when you do come. So you can ski in the winter. We got the Mighty Five, the national parks that are a worldwide draw. Zion is one of the most visited national parks in
How
the whole
far
park
is Zion?
system. It's about 3 or 4 hours away.
Yeah.
So
Now you said snowbird easily. Park City's pretty amazing.
Park City's very nice. I'm not, yeah, don't.
But the locals go to snowbird?
A lot of them do.
Yeah.
It's not maybe as crowded, not as much traffic, and a little steeper slopes, a little deeper snow. Yeah. So, yeah.
Steve, we're going to spend more time with you when we get into the tour, but let our Crisis Jam know a little bit about your background as a state representative and the work you do with the University of Utah and impact you have with mental health substance use.
Yeah. So I've been in the Utah legislature for about 15 years, and I'm a CPA by training. Didn't really envision working in the mental health space until 3 children. Right after I got elected, 3 children, my son's school died by suicide. And one of those parents tearfully pleaded with me to do something about it. So I started researching what we could do, came across Dr. Greg Pudnell and his work with Hope Squad, started running bills. And I think this past session, I probably passed several mental health bills. I think I'm up to about 70 mental health bills now. And so it's become a great passion for me. I still like accounting, but my heart's in mental health.
Now, Steve, I was thankful to get a warm blanket from someone here. I came from Phoenix without my overcoat. What is it? It was 25 when I woke up this morning. What is it?
It's going to get up to 42 today, and next week it'll be up to 72. So if you don't like the weather in Utah, just stick around for a few minutes or a few days.
Oh my goodness.
So,
Steve, what's your hope for this Kim and Carolyn Gardner Mental Health Crisis Care Center?
Yeah, so we're on the Huntsman Mental Health Institute campus of Hope here, and it's about 9 acres. This is the first building constructed. Of course, the 30 recliner crisis receiving facility, as well as 24 inpatient beds and a host of outpatient services, which I don't want to steal your thunder. We'll get to that in a few minutes. But we're calling it the campus of hope because that's what it's going to be. We'll see some of the design features. It's meant to inspire hope. It'll be world-class clinical care. And this is just the first installment in other buildings that will come to this campus, but we hope it's a model, not just for the nation, but for the world.
So we're going to go live, Steve, in about 2 minutes. I'm wondering who, Karen, we have in the gathering in the lobby, and if anyone has a question for Rep. Steve Ellison before we go inside. Steve, we've got folks from all 50 states. We had people signing up for some of the territories yesterday, and folks from overseas. So welcome. We're excited about our first live and on location Crisis Jam. We've not done it before. Appreciate our filmmaker, Justin Shelby, being with us to make this happen, and Kristen Ellis, Karen Jones, and everyone who's put this together. So any questions or comments from folks in the jam that before we go live here? Let's get a view of Kevin Curtis while waiting the start there.
If anybody's wondering how much snow is up in those mountains, Snowbird this morning has about 140 inches on the ground. So,
well, and everyone got to see you skiing. So, Steve, I think we head for the front door.
Right.
No, it's not a shawl. The warm blanket is the metaphor.
Yes.
Kevin Curtis.
Welcome. I'm glad somebody got you a warm blanket. You're ready for the full experience.
I very much needed it. Thank you so much for hosting us today for the first live and on location crisis jam. How long is this?
I mean, it depends. Talking about the project, I've been involved with it too, all the stuff that happened before. Now we're just sitting
A week and a half. Well, you've got a parking lot full of the final
Yeah,
touches.
yeah, we're still finishing off some final details with the construction, getting it ready to go, and then we've got the building full of staff, getting the trains to be able to open up our doors.
Well, welcome to our first live and on locations crisis jam. My name's David Covington, and I'm thrilled to do a tour with Kevin Curtis today, Director of Crisis Services. Institute. We think this is going to be a game changer in terms of you're going to see an amazing facility, but it's also this warm blanket, this way of providing care, the experience, Kevin, and the direct access that we're going to see from law enforcement and the community.
Totally. Yeah, I've been a long student of the receiving center model, and on this project, we really thought about what does it mean to receive. This shouldn't be about warehousing and moving people. This should be about how do you make a person feel received in that process. And the warm blanket has been the metaphor that's helped us really make that value come to life.
Right. The new SAMHSA guidelines use the description and the model service definitions of high intensity behavioral health emergency crisis care center and crisis stabilization. And you've got both of those rolled up here with all of the resources and the staffing to pull that off.
Absolutely. Yeah. We've really leaned hard into making this a functional service for the people that receive care there.
All right. Well, we're going to meet a number of amazing stakeholders who've helped make this happen as Kevin and I take a stroll through this facility. So Kevin, lead the way.
Sounds good. All right. If that's not a metaphor, I don't know what is.
David Huntsman, thanks so much for being with us. David, president of the Huntsman Family Foundation.
That's exactly right. Yes.
And I want to start, David, I've with everyone today, I've been doing an either or. What's your favorite? So for you, I actually have your either or is Sundance Film Festival or Twilight concert series.
I think Sundance has been stable here for so long. Rumors are that it's going somewhere else. I hope it stays here.
Now that I've not heard.
So
Okay.
I don't know, but my kids have all loved going up to Park City looking for stars. So
Yes.
Sundance.
Well, Justin and I, of course, our filmmaker with the Moving America's Soul and Suicide documentary, we're so thankful to you, to Christina and Rick for helping host that film here. And I'm actually going to show on the screen for our audience the picture that inspired us doing that when you were looking out the back of that auditorium at the cancer, was that the cancer research?
The Cancer Institute, yes. And thank you for highlighting all the amazing things that are going on. You know, your audience, we're just so grateful to you and, you know, highlighting these important things, you know. And we're so excited today to be able to highlight this amazing building. You know, as far as I'm concerned, this is one of the most important buildings to open in a long time because of the amazing work that's going to happen here.
So David, before we get to this building, let's talk about your family, your parents, John and Karen, and your siblings, you and your siblings. You've invested in Utah in cancer research, cancer treatment. What are you most proud of the impact that that's had?
Well, we love the work that's happening in cancer. And, you know, if you were to ask to choose either or between cancer and mental health, that's like picking a favorite child. My father's goal with cancer was to someday go out of business, to find a cure and eradicate cancer from off the face of the earth, you know, and we're working aggressively to try to do that someday. But mental health, you know, we're on the front end of this journey for mental health. And so our family, our generation, my siblings have made the commitment to put foundation resources in a significant way behind mental health, because this is our journey, this is our experience, and this is what, resonates with us.
Your parents challenged you to find what would be your thing, because your dad had cancer and turned his.
Cancer was his journey. He was a multiple time cancer survivor. When he walked into a room, he used to say, all those affected with cancer are direct. The thing that affected the greatest number of people, maybe it's even more so than cancer.
What was behind you and your siblings determining that mental health, substance use would be your focus?
As we looked into it, we realized that there was such a prevalence of stigma around mental health. People weren't talking about it. In our extended family, there was mental health. We used to joke that we don't have mental health in our family. We just have alcoholism and suicide, but luckily no mental health, and we just saw that it was something that we need to put resources behind. We need to do better. The way we've treated in the past isn't good enough. We have to find ways to treat people in crisis, because that's our family. That's every family. And it's just so important that we have resources like what you're talking about today, here in this building for everyone to have access to.
So Kevin, you used the word receiving center, and this lobby communicates you are received, you are welcome, this matters, and the investment of the Huntsman, of Kim and Kelly Gardner, and others in the community have helped make this happen. Why is this important to you? And tell us about this opening.
Yeah. So I think a lot of the participants on this live stream will relate to the idea that mental health typically happens in the darkest, dampest corner of the building that nobody wants, right? And so we're used to being really scrappy and figuring out how to do it as well as we can in under-resourced and under-planned sort of locations. So this opportunity for me really felt like something where you've got all of this experience of doing it as well as you can without the resource, to how would you do it in an ideal fashion with the resource?
Yeah.
And our partners at the Huntsman Family Foundation have been pivotal, not only in helping us connect a resource, but also challenging us to think bigger.
Yeah.
No, you're not thinking big enough. You're thinking good enough. What is the actual, if you were to do this well and right, what would that look like? And so you see a lot of that coming out in this building.
I remember one of our first conversations before the family ever made the commitment to give a substantial gift.
Yeah.
We met with them and we said, what would you do if resources weren't an obstacle? And they said, we don't know. We've never been able to
Never
think
been in that
way."
position
It
before.
said, that's never a luxury that we've enjoyed. And we said, well, we'll think about that. And we actually came back and had a follow-up meeting with them, and they started sharing their ideas. And one of the biggest dreams they had was to have a receiving center that was properly funded, that had the resources to treat everyone that walked through the door. And that was one of the first things they said was on their wish list. And so here we are, a few years later, and we're so honored to be a small part of this effort.
Not dilapidated, but also not hospitally. It's a welcoming, it's warm. We're going to get to that warm blanket as we go through this. But also I don't feel there's not a communication of danger and fear, plexiglass and security keypads. There is some of that, but it feels like it flows and it feels normal.
Yeah, we wanted the building to be safe and we wanted to be functional, but we were always coming back to how do you do that? How do you do safe and functional in a warm blanket approach?
Yeah.
Right. So that metaphor came back 100 different ways as we were designing. So those safety features are sort of tucked in the back. They're not in plain sight. They're not the experience. They're there as functional tools that you use when you need them, but we're not designing for the outlier case. We're designing for a good experience for everybody who walks through the door. And then the outlier cases, we have the tools that are sort of tucked in so that they're not the overwhelming experience that people have when they walk through the door.
Kevin's not going to say this.
Yeah.
But he's largely been the mastermind behind this facility. He has fingerprints on every aspect of the building. And And we gave him the challenge that when it comes to treating people in crisis, we have to do things in new and better ways, and we have to raise the bar. And I think this building is the result of that effort. Thank you,
Terrific.
Kevin.
David, thank you. Thank you to the
Thank
Huntsman
you.
family for your passion, for your investment in this, for your leadership. Thank you to Christina. Thank you to all of your mother. This is going to inspire many.
This is
communities.
important to all of us. And so we all have the same end objective here. So thank you.
Okay.
All
So
right.
Kevin, let's keep our journey going. Now, Kevin, David was talking about your fingerprints on this facility. Pretty cute. But you were saying, you weren't saying, I want to say that one of your first work opportunities was in the Urgent Psychiatric Center in Phoenix, Arizona. So
That's
tell
right.
that story.
Yeah, so I didn't know a whole lot about crisis care. I was doing grad school down in Phoenix at Arizona State, proud Sun Devil.
Yeah.
It was just a model I had never seen or experienced, and I started with a kind of internship practicum experience, and then ended up working there for a little bit. And it really gave me some foundational knowledge about what those programs are, how they work, and how they provide access, but also support our public safety systems as well. It's a really great model.
So that no wrong door
Mhm.
philosophy that you saw, we're actually having a fireside chat with Dr. Chris Carson next week in the Crisis Jam. So we'll welcome him then. But that no wrong door, there was a time when hospital emergency departments didn't have a no wrong door. So we're going to start with our crisis trivia hot seat. And Kevin, you're in the hot seat today.
All right.
So our question for today, I'm going to read it to our audience as we bring it up on the screen. Which was not a reason for EMTALA in 1986? A, denying emergency care based on ability to pay. B, stopping the practice of patient dumping, where a transfer happens without stabilizing. C, ensuring pregnant women in active labor receive necessary medical attention. Or D, reducing overcrowding in emergency departments, addressing psychiatric boarding.
So which one was not?
Which one was not?
So three of them are, one of them is.
Three of them were rationales for the Emergency Medical Treatment and Labor Act in 1986.
I anticipate that they weren't thinking about mental health at all, that they were pretending that it's not a problem that exists.
So psych boarding, reducing overcrowding in EDs, ensuring pregnant women in active labor receive medical attention, stopping the practice of patient dumping, or denying emergency care. So those of you in the audience, you'll see the poll up. We're gonna walk and talk here while you fill that out, and we'll come back and get the results. But a little bit of a hint, EMTALA was designed to improve access to emergency care, not restrict it. Okay, let's keep walking. So at that time, before EMTALA, emergency departments actually were locked. I mean, you don't get in the front door without a invitation. You rang a bell, and if someone was available, they came to the door. If they did come to the door, they were looking to see who was your physician on panel with the hospital, who was your payer source. So EMTALA, of course, changed all of that. And what's our poll look like? What are the results of the poll? Yeah, so we've got the majority of you in the Crisis Jam audience, well, right at 50%, said that D, reducing ED boarding. And yeah, that wasn't a focus. It wasn't about restricting access. It was about making sure people had access to care. So let's go to our next partner, and we've got Chief Daniel Croyle.
I'm gonna hand you this mic, Chief.
Okay.
Nice.
So Chief, before we learn a little bit about you, I've got an either or for you.
All right.
What was your favorite? Was it working in the FBI field office or working with the Ogden Police Department? It's like asking which of your children, but that's it.
I spent more of my career and law enforcement career working at Ogden Police. And so I would say Ogden Police Department. But I'll even go back, my most favorite position, even though I'm the chief now and work my way through, was working with victims of domestic violence and child abuse and sexual assaults. And so working with that compassionate care and investigative prowess to
Yeah.
work those types of cases.
I love Ogden. We've been there for Spartan races up in
Oh,
the
yes,
mountains.
yep, up there by Snow Basin
Yeah,
and up by Powder
exactly.
Mountain and
It's so
all of that.
beautiful.
It is a nice area.
Yeah. So I've only seen this setup for law enforcement drop off in the Tucson facility of Connections Health with Margie Balfour. Would you show us
Sure.
how this is going to work, Kevin?
Yeah, absolutely. We'll see if the doors work.
Yeah.
I don't think they are.
Well,
Oh, you got the magic key.
I got a key. So I
right.
think between
Okay.
the magic of keys.
There we
All
go.
right,
Perfect.
so he does have a key.
We're still learning this building. We got a week and a half.
Maybe we stand over here. Oh, shut up.
So this is one of our officers that works with our homeless resource unit
Yeah.
that's where this is located. Do have, we will bring individuals here that are experiencing mental health crisis. So he's also been on the tour and looking at how we bring patients in and bring those that are experiencing that.
So Kevin, can you describe the flow for us? How will this work? How do they communicate, locking up the gate so that we have a secure, protected environment? And what's the flow look like?
Yeah, definitely. So they roll up to our gate 24/7. There's a intercom system that they can communicate with our security team. They release the gates and they're able to pull in. The gates close to create security in those transitions. And we're able to have our staff receive our law enforcement partners 24/7. We've been piloting this for quite some time, and our handoffs with law enforcement are taking about 6 minutes, which is a big metric that we look at. We, as an alternative to jail booking, as an alternative to emergency rooms, we think a key way that we can support our law enforcement and some medical service folks is to give them a quick transition so they can get back out to the street and doing the work that they're saying.
The Los Angeles police have coined this phrase wall time, where they go to a hospital and get caught there, land up standing up against a wall, waiting. What does something like this mean for your?
Well,
force?
for our team, it's a place that you're transitioning, right? But also that they could do reports. It is a safe environment for them to come in so that they're able to focus on the needs of the patient. Come in, transfer the patient to personnel here. They can still have a break for a few minutes, work on their reports with the report writing area and have a snack and then get back out there on the road.
So you bring up, there were two things that law enforcement asked for, Kevin.
Yeah. We early on, before we ever put pen to paper on the design, we brought in law enforcement leaders and asked them what would a warm blanket look like for our law enforcement partners, and they said a bathroom and a place to grab a snack. And so we designed in a little lounge off of our handoff area so that when they come in, we can take the handoff and they can take a beat to use the restroom, grab a snack, write that report, so we get back out.
So we've got Dr. Brian Sims, who's the medical director at the National Association of State Mental Health Program Directors, the Trade Association for Behavioral Health Commissioners. Dr. Sims, do you have a question or comment that you'd like to make for Chief Crow?
Well, definitively, I have a comment, and that is, first of all, thank you, Chief Crow, for sharing that wonderful information. It's exciting to hear because many of the states have been saying to us over and over what kind of process could be put in place, and it's just such a thrill to see this in place. I did have a question with regards to processing, but it seems like you've answered it because I was concerned, not in a negative way, about the intake process for the people being served. But I also wanted to know about the officers themselves, the law enforcement. How is this seen as really an advantage for them? And I think you went through some of it, but if you had any other comments, I'd love to hear that.
So two quick questions. One is that what are the advantages for the officers that they would see in this kind of program?
I think it's better, it's safer, it's more supportive, it's more of a comprehensive supportive system that we are collaborating with the Huntsman Mental Health Institute and working with those professionals. So we know too, also, we can also learn from them. Like if we have somebody that's combative, what were some techniques for us to de-escalate? And so those are things that we're always learning to improve on. And so I think there's a lot when we collaborate together that we learn collectively and how we can apply it to the job and task.
Dr. Sims, thank you so much for your comments. The other question he asked was about the intake process itself. Let's go back inside and
Sure.
see a little bit more of that. That's what that.
Yeah. All right. We're gonna see if the magic key works in the other direction. So, and Dave, real quick, before we speak to intake process, one other thing that came up in our data that we collect on the pilot, our law enforcement officers, every time they drop somebody off, they give us some quick information. One of the questions is, where would you have taken this person if not for this service?
Right.
And we expected to get a lot of, well, the emergency room, the shelter, or jail. 30% of the time they're marking, I don't know
Oh,
where I
wow.
would have gone. So to that point of benefit for law enforcement, there's a pretty high threshold for when they're gonna go to jail, or they're gonna drop a civil commitment hold,
Yeah.
or they're gonna go to put somebody in jail booking.
Yeah.
But they see people every day that they know need help, but there's not the resource, or they can't force it, right? And so I think there's something about this that's lower barrier, that they feel like they can use this in situations where they couldn't use those other tools.
Yeah.
So we really like that as one of our functions too,
Yeah.
providing a new tool.
So we've got a number of things here, including the scale here that you just stand on. But one of the key things I think is the observation area that you have, because people can come in with big feelings on board, and if they go into the unit, it can impact the milieu.
Yeah.
You have all the tools to make sure they're stable.
Yeah, no wrong door means no wrong door. And if you're gonna do that and you're gonna be no refusal, you have to have the tools. Now, we hope this room gets used a percentage of cases,
right.
only in the situations where it's needed. But by having it here, that's what allows you to be very inclusive and very broad in allowing folks to be brought in.
Chief Kroll, thank you so much for your leadership and for your partnership in this part.
Yeah, this is gonna be a great partnership.
Thank you.
Thank you.
Thank you, Chief.
So there's a question from the community around, is the drop off, will we just see law enforcement, or will we also see EMS?
Yes, EMS, fire, various different paramedics crews.
And are you seeing those other partners in your pilot program
Yes,
now?
yeah, we are seeing them use these services.
So we're now walking, Kevin, toward you've got a co-located mobile crisis as well as an area for law enforcement. Are there liaisons? Tell us more about that.
Yeah, so our facility sits in the catchment area of South Salt Lake Police, which is the organization Chief Croyle oversees. So we created a business associate agreement. So for those law enforcement officers, they have kind of touchdown space back here so that they become an extension of us in that partnership. And then also in this zone, we have space for some of our mobile crisis teams to co-locate in support of this coming online as a dramatic expansion of our statewide crisis response system. So
Claudine, welcome.
Thank you. Thank you for having me. I appreciate it.
So Claudine, you work with the mobile crisis team.
That's correct. I'm part of the integrated behavioral health system here at Huntsman, but I am the mobile crisis team manager.
So we've been starting with each of the people that we come across in our journey with an either or. Well, we've been giving them easy, what's your favorite things? For you, it's a little harder. What's more important? There's no right answer, but what's more important? Chief Kroll was just talking about de-escalation. Is crisis de-escalation more important or crisis follow-up more important?
Oh, that's a tough one because they both have a place. We have to de-escalate so that we can create the services and do the follow-up care. So both of them are equally important, because if somebody's still escalated, you can't even talk about what's the next step. And that next step is what is going to involve, the follow-up care.
You've got a full continuum here from a statewide 988 through mobile crisis and facilities. This isn't the only facility. You've got numbers of other facilities across the state operated both by University of Utah and others.
That is correct. Yeah, we have the integrated 988 crisis line. We had about 91,000 calls received over the past year. We have the warm line, which is, I'm not really in crisis, but I would love someone to talk to.
Yeah.
We have a Safe UT app, which was developed here in Utah for students and educators in the schools. And then we have our mobile crisis team, which serves Salt Lake County right here. But there are teams throughout the entire state that are deployed through the 988 call center.
Dr. Brian Sims is asking about the trauma-informed training and approach to the work that you're doing.
So at 988, all of our people who answer the phones are certified crisis workers. So they are extensively trained. On MCOT, we are a team of a licensed clinician and a peer support specialist. Safe UT is all licensed clinicians. And our warm line is all peer support specialists who are also certified crisis workers. So we really take into account the trauma-informed care and make sure that it is across all continuums.
Claudine, I was asking you if there was a theme for your team, and you wrote "Be Curious."
Yeah, it's so important for us as we go out on outreaches and we're interacting with our community. And sometimes it's the unhoused community, sometimes it's people we've seen before. But no matter how many times we've seen somebody, or no matter how many times we've heard, I'm depressed, that element of curiosity has to be there so that we can do the best assessment that we can. So our motto for all of MCOT is to be curious.
Love that. Thank you so much.
Yes, thank you.
Thanks, Claudine.
Thanks.
So Kevin, tell us again when you're going live and what that's going to look like.
Yeah, so we have a couple of events. We have a ribbon cutting on Friday, March 28th, and then a block party for the community on Saturday, March 29th. And then we open our doors for patient care on the morning of Monday, the 31st of March.
So we literally had someone come to the front door and seek services as we were putting the program together this morning.
Yeah.
So the word's getting out.
Our community needs this service. I think the word is getting out. We want to start this yesterday. We've got a few details to finish up so that we can do it safely, but we're good to go.
So I want to make sure the community understands, we were just in the receiving the actual intake for law enforcement, EMS, fire.
Right.
And right through here, we're now in the observation,
That's right.
and you have 30 recliners,
We do.
but you've configured that in a really special way. But before we get to that, we're going to talk about the design of the facility itself.
Absolutely. Yes, and we're really lucky to have our amazing interior designer from FFPR Architects, Sydney Young. She's been such a key partner in this process with us.
Hello, Sydney.
In addition to being a really fun and awesome person.
So Sydney, you're sitting in one of the actual recliners themselves. I'm going to use this one here. There's an easy lock thing, I think. I'm going to roll this over here. So Sydney, tell us your role and the organization that you're with.
Yeah, so I'm a senior associate interior designer at FFP Architects, and I've had the immense pleasure of working on this project. It's been really near and dear to my heart and a really great project.
Great. Before we jump into that, I've got a fun either or
Oh, please.
for everyone. So for most people, it's been what's your favorite, but for you, what's more important is it form follows function,
Oh,
or is it emotion drives design?
and I have to choose.
You have to choose.
I think emotion plays into form follows function. I think that you kind of need both to create something that's really impactful and beautiful. So that's a really tough question.
Yeah, and can you hold the mic just a little close to the audience and saying that the volume's a little low?
Sorry, thank you.
So, Kevin, one of the things you talked about is facilities like this tend to spend a lot of time talking about process and flow. It even becomes all like a shipping and receiving throughput kind of thing. And Sydney, the customer, the guest experience has really driven this design. Tell us about how this is coming together.
Yeah, thank you. So dignity and really creating this hospitality type of design where you come in, Kevin's mentioned no wrong door. You know, we really want people to feel invited and welcomed. And, you know, we've been really intentional about the materials that we use and how we use them. So softening curves and, you know, doing really intentional lighting, bringing in these elements that create positive distractions like this panel behind me, so that as you're sitting here, you're not necessarily, you know, staring at a blank wall. You have these opportunities to kind of let your mind and your eye wander in a way that is really productive to the healing process.
Yeah, it really does. My first thought was, is that a design? And then it's actually it's what do you call it? It's carved out.
Yeah, it is recessed.
A
It's
recessed.
carved into that panel. Yeah.
It's beautiful.
Yeah.
There's this, I think we're going to talk about the ceiling later, but maybe just briefly that open area that we first came into, Kevin.
Oh, yeah, in the lobby, the undulated, yeah, so we do have undulated wood ceilings out in the lobby space, and that was really again, creating these moments that felt like Utah. So, mirroring our mountains and our rivers and our lakes and our valleys, all these beautiful curvatures that we see. So out in the lobby, you start at the beginning of the building and it's got a lot of curvature to it. And as you proceed into the building, it kind of evens out and calms out. And that's, again, a design intention, but also mirrors kind of the idea of when you enter in, you might be having a lot going on under the surface. And as you get the care that you need through here, things, mellow out and become a little bit more calm.
More peaceful.
Yes, more peaceful.
Kevin, any questions or thoughts for Sydney?
Yeah. What was the experience like being on this project in relation to other sort of buildings? Like what made it meaningful for you?
Oh, I love this question because I think that behavioral health has typically aesthetically not been something that could necessarily help to provide the outcomes that we're really looking for. And this building provided a really great opportunity because we're pushing the envelope. We're asking, the questions of how can we further care? How can we better care? And the design played directly into that. So I think having that tie-in and that relationship of how are we getting better care and how can the design support that? And then knowing that it's going to have such a great impact on our community and it's going to be providing a really valuable resource and really breaking that stigma of mental health, not only through all of the wonderful work that you guys are doing, but also in a design sense of how can we make this really look and feel like a welcoming hospitality space instead of a traditional mental health space. So that's been really
Sydney,
nice.
thank you so
Thank you.
much. Thank you.
Yeah.
We've got a question in the chat, Kevin, about the fee model, and I think we'll save that until
Sure.
we're with Rep. Elison toward the end of the program. Well, we're now going to walk quickly out to the, you've got a healing garden.
We do.
That has a labyrinth, and I think the snow really creates a beautiful view of that.
Yeah, one of the kind of ways that we sort of conceptualize warm blanket. One of the concepts was bringing in as much natural and intentional light as possible, but also bringing nature into the building and bringing care out of the building. That kind of grounding function of nature is really important to care in the healing process. So
everyone will have access to this regardless of the program they're in? Or?
Yeah. And so that's the thing. And I think Sydney kind of touched on this. In behavioral health design, so much is pushed by regulation and safety. And I think a lot of people don't really wrestle with how do you do kind of welcoming warm spaces and functional spaces in tension with that safety. So, you can kind of see we're in kind of a more sparely designed courtyard. It's done this way on purpose because it allows us to make it accessible to people when they first get here.
Yeah.
Once they've gone through our processes and have had kind of evaluations and we have a better sense of their safety, we have a much larger, kind of more functional design that has a bit more risk designed into it.
So we'll show the drone footage of what it looks like from above.
Yeah, excellent.
So what is the thinking on the labyrinth? People are asking.
Yeah, it's just a space for meditative walking. We want space to feel open, but we also want there to be a kind of structure that allows people to engage with it in whatever way feels healing to them.
Yes. And we're actually disrupting the training that's going on for the clinical staff who are getting prepared for 2 weeks from now.
Yeah, this is a group of our therapists, our case managers, and some of our peer support specialists that are here training, getting ready for us to go live in a little bit.
Can we interrupt for 1 second?
Yeah, absolutely.
Just a quick question for our Crisis Jam community. How many of you have worked in crisis facility care before? Anyone that this is new for? Okay, great. Many of you work in the pilot program now? And what is your name? Fabiola, what are you most excited about with the new facility opening in 2 weeks?
Yeah, I'm excited because we're gonna expand our services to the community. And this location and the facilities are great, and we have a great team already.
You're a
We've
social
been-
worker?
Yes, we've been working with this in the small receiving center for a year or
Great.
more, so.
Thank you for joining us. So Kevin Fabiola is referencing that you've actually sort of stepped into this larger facility. You had a crisis facility. You then had a larger crisis facility that began to deploy the no wrong door,
Yeah.
and now you're going to go to this larger facility.
Exactly. So we started with a 6-chair receiving center that didn't fully function on the no wrong door, was not appropriately sized to the community. As we were developing this one that's scoped out at 30 chairs, we had an opportunity. This is a cool thing to point out, but the Salt Lake County Council unanimously voted to appropriate funds for us to expand the space and pilot the law enforcement no refusal. And that has been such a great opportunity to learn and be prepared to do it at this scope and scale that we're doing today.
Yeah. You know, what we sometimes hear about warehousing, and we even with you know, this is not an inpatient, this is the crisis facility. But the approach you have here, Kevin, of this line of sight, and yet these pods
Yeah.
that allow you to see the 10 chairs in each of these for 30 chairs total capacity. Talk briefly about your concept of reverse movie theater.
Yeah, so I mentioned I'm a long student of the receiving center model, and I've always been aware of some of the value that it brings, but it's always felt to me like it's lacking in the human aspect. Those environments often feel like they are warehousing people. And I've coined this term, the reverse movie theaters, how a lot of these places feel, where you've got staff behind glass watching people in chairs that are all in a row. They're designed to suggest you sit there, we sit here, we watch you, and it doesn't feel particularly healing. It's great for observation maybe, but we felt like these environments could be so more human and so more functional.
Yeah, terrific. Yeah, terrific. Okay, we're gonna walk up 3 flights of stairs now.
Yeah. I'm gonna be out of breath. This is just a trigger one.
That's the plan.
Yeah.
Kevin, if we could talk a little bit about the integration of substance use care, and this is not just a mental health crisis. If somebody can be suicidal, they can have a substance use crisis or some combination of those.
Absolutely. Yeah. So people can come to us. We don't define crisis for them. They come in, and sometimes that involves a primary health diagnosis, sometimes a primary substance use, and sometimes a co-occurring dual diagnosis. So we're prepared to evolve. There was a question about process. Everybody that comes in, their triage involves gathering brief medical history, vital signs. And then we do the CSSRS for getting a quick picture of suicide risk. We do the Barber number of SAT scales for agitation and violence risk. And then based on medical history, we're doing a number of different detox risk screenings. For those that have those needs, we have the ability to start NAC treatments. We can use Suboxone. We can manage the early stages of detox while we're looking at the right connections. We have a pretty broad ability to receive people in substance use crisis and at least provide that first comfort care while we're making. Yeah.
And we've got another view of the labyrinth from here, Kevin. Yeah. And the mountains. What mountains are we looking at there? There's also a question in the chat, Kevin, about who can be served here in terms of age.
Oh, yes, it's an adult facility, so we don't put an outside parameter on older individuals, but they need to be 18 and over. In our triage processes, we're licensed like a freestanding hospital, so we do have the ability that if an adolescent showed up, we could at least evaluate and connect them to appropriate services, but our care spaces are 18 and over.
When we were walking through this space yesterday, Kevin, I was assuming this was like a wood. It's actually not. Tell the audience what that is.
Yeah, this is where I go into infomercial mode. Yeah, this is a really cool product. It's a great example of a warm blanket design choice. We wanted our environments to be soft. We wanted them to be quiet and healing. And this is a product that is a hybrid that lives in the space between linoleum and carpet. So
Well, the reason people use linoleum is for the ease of care. It's
Yes.
easy to take care of.
Yes, it's hydrophobic, so, you know, liquids just kind of ball up on the surface and you can wipe them off. It's a really functional, but it's got a slight texture to it that absorbs sound and it has a softness to it that you can't get with hard surfaces.
You're getting, are you 99.9%?
There are some signs that we've got a little bits to go, but we are very close.
Hi, Bruce. Thanks for joining us. So, hi, you're with the, what do we call
The
it?
Patient and Family Advisory Council.
Patient advisor. So I've got a either or for you, Heidi, because your day job is with the Pioneer Theater Company.
Yeah.
Either or, Les Mis or Shucked.
Oh,
I'm
geez.
not familiar with Shucked.
Shucked started at PTC, that's what we call it, internally. Shucked started there before it moved to Broadway, so I've gotta go with that, even though I saw Les Mis first. It was one of my favorites, and it's the first musical that made me cry. Shucked means more to me with where I'm at right now.
So lived experience helped fashion the design of the facility, the model of care. Tell us about your involvement with this.
Well, I've been on the, we call it PFAC, the Patient and Family Advisory Council, since the beginning. They really came to us about everything from the furniture to the entry to the artwork. We met with the designers, we met with the staff, we met with everyone, the marketing, every step along the way. It felt like it wasn't perfunctory, like everything was really being listened to and heard. And when we got to do our tour a couple of weeks ago, we could really see that that was the truth, which was impressive.
Kevin, the warm blanket, even you've used the reference of hospital staff welcoming a baby into the world.
Yeah.
Talk about the involvement with the PFAC and how you got to where you are.
It's funny, and Heidi used the word perfunctory. We really did come in with a desire to make it real, but it wasn't an entirely easy process. There were moments where I thought I knew what the answer should be, and a different answer came back, and I had to be like, well, why are we not in line here? Why aren't they just repeating? And it's like, I don't bring the same experience to this process. So there are so many examples of things that they told us that we just never would have thought of. And when I walk through this building and I feel those feelings of there's something special going on here, my first thought is the Patient and Family Advisory Council. They just brought an expertise to this that myself as a care provider just could not bring to it. I don't use the space in the same way. I don't live in the space in the same way. And so having that experience has just really made us able to really live that value of the warm blanket from the perspective of lived experience.
Right. So we're going to bring in a question from our Crisis Jam community. We've got Stephanie Hepburn, who's our editor at Crisis Talk. Stephanie, what's your question for Heidi or Kevin or comment?
So originally I was going to ask Heidi what she would like to see at other facilities, what she would like to see them adopt as well. But hearing Kevin's comment, I would love to know a little bit more about an example of that tension that you were describing, how it wasn't an easy process. And if you could give an example or two.
Yeah, so Heidi, Stephanie's asking about is there a place where you had a tension around a particular topic and how did you work that through?
Oh, I mean, there were several. I know that you looked at the labyrinth earlier. I feel like in the HMA tri-building where a lot of us came through prior to this building, getting access to the outdoors was really, really important.
Yeah.
One of the things.
So there was some resistance to that up front.
No, I think it just looked different.
Yeah.
And I think that talking about how making it a like kind of livable and active space versus just a space that existed.
Yeah. Because
a lot of people go out there with intent and with purpose. And I really felt like that was reflected actually right here. This door opens into a balcony. And
let's see it.
When you're sorry, when you were in our meetings, we never talked about something like this.
Right.
But we always talked about how important it was to not feel trapped and to not feel like you need a warm blanket coming out
Yeah.
here, but it's basically like access to any kind of openness, any kind of space makes you feel, the healing process really helps with that rather than feeling trapped.
Yeah.
And we never talked about anything like this. And when we came through the tour, I don't even know if Kevin knows or anyone how meaningful it was to see experiences we've relayed, conversations we've had, like put into motion in a way that we hadn't even known was going to exist.
So there's a
You
lot
really
of
felt heard.
iterative feeling. It's
Yeah.
great, terrific.
You felt heard and it's really, it's an important thing that people are going to, it's gonna resonate with people in crisis significantly, so.
Thank you so much for being with us today.
No problem, thank you.
So, Kevin, I was actually here in August of 23.
Okay.
And at that time, there was no flesh to the building. It was just the bones. You were laying the last girder. And yesterday, we're not going up there. The reason we're taking stairs instead of the elevators is because of Wi-Fi.
Yeah.
And we lost Wi-Fi on the roof. But tell people about the beam, and we're going to actually start showing the footage of that we shot yesterday so that people can see where that beam is and what it means.
Yeah, yeah. So there's so many things within this building where we've taken the opportunity to, we want the people that work here, we want the people that receive care here to be reflected and be in the DNA of the building. So when they were finishing up the steel work for it, we talked about, is there a way that we could kind of commemorate that? We did a beam chopping off ceremony. And so we were able to have this giant steel beam brought to several different care locations, solicit staff to come and sign that beam. And so, this isn't symbolic. This is literally kind of a corner piece to the building that lives on, that's here, that reflects the many, many people that contributed to making this a real thing. But
So when you access the roof, you're able to actually see the beam in place.
I didn't know that would happen. And so I had a chance to go up for the first time just yesterday.
Yeah.
I had not been up to
You
that
hadn't seen
space.
it.
And I saw it and it sort of brought a tear to my eye to see that. And so I mentioned it to you, and then of course we went on a field trip up to the.
Yeah, out into the snow.
Yeah, yeah.
So Kevin, we're walking onto the second floor. Tell us about what happens here.
Yeah. So the second floor is all about transitions and resolving drivers of crisis. We know that crisis is often an issue of biology, neurochemistry, genetics, but many times it's an issue of unresolved drivers of crisis and people that are hopeless and don't see a pathway to resolution. So in our design many years ago, we felt it was important to have some services here that could be focused on quick connections within building that we own that help people start the process of resolving drivers of crisis.
So you've got a number of partners, legal and employment, medical and dental.
Yes. So those are all different collaborations that help us provide that access. They're also associated with our college, the University of Utah. So we're training learners. We're building the workforce while we're providing some of that access. We also
Medical coming on board. It looks like
this
a
is
dental.
kind of evidence of still yet to be installed dental equipment.
Yeah.
So really exciting that we can ask those social determinants of health questions and have direct things to connect people to help resolve.
And research. So you already referenced some of the outcomes that you're tracking. The question you're asking law enforcement. What would you have done?
Yeah, exactly. We know that mental health is underfunded. And we take seriously the responsibility that if we want to be better funded, we have to tell better stories about what we're doing and why. We need to tell better stories about the effectiveness of what we're doing. And most importantly, we want to have the ability to tell stories about the impact of what we're doing at the economic level, the societal level, and we can only do that. We're not the experts in that. So research collaborations are brought in the building to help us do that and tell the stories better.
Representative Steve Ellison.
Hello,
Great to
David.
see you, my friend.
You too.
Hey, before we get to Steve, Kevin, there's a question in the audience, and I didn't spend enough time talking about flow and the number served. So you have 30 recliners in the observation. You have how many inpatient beds?
We have
which would be your short-term crisis stabilization.
Exactly. So 30 recliners. We have an average length of stay of about 10 hours. So we actually can operate at about 150% capacity. So we do have the ability on those 30 chairs to serve about 45 people in a 24-hour cycle.
Yeah.
Through that first floor service.
And in your pilot program with your 12 recliners right now, you're operating at 90 to 100%.
We've well exceeded 100%. And that's been consistent. So we have days where as outliers we're at 200% of our capacity over the course of the day, an average of about 130%.
And then how many inpatient beds and what's the length of stay you expect there and the percentage occupancy?
Yeah, we have 24 inpatient beds. We set them up purposefully to be all private rooms so that we can operate at 100% bed capacity. We anticipate those beds to be full, but with regular movement. In our traditional inpatient, our length of stay is about 10 days. We're targeting as kind of an early target, 7 days in this, but we hope to over time and through improvements in care to get these even shorter stays so that we have access, as well as we can get people feeling better and back to their homes more quickly.
So on a given day, you'll be admitting and serving 45 to 60 people a day?
Yes, just in our first and third floor, and then through our outpatient services, we anticipate many more. So it's going to be a very active facility with lots of different functions.
Rep. Ellison, we've had discussions. There've been hundreds and hundreds of people involved with 988 over the course of time, but you're one of the very few. I think it just doesn't happen without your engagement and involvement and your leadership and passion for this work. So we have an over-under trivia question for our audience. And Dr. Richard McKeon, I hope you're there with us. We're going to put Richard in the seat of answering a question. And we're going to look to our audience to say over-under, but you're going to give us the ultimate answer, Steve. And the question is, when was that seed first planted of a national number that would become 988, a 3-digit crisis and suicide hotline, help line, lifeline? So, Dr. Richard McKeon, what date do you think Steve is going to say, month and year of when that seed was first planted in Utah, which ultimately led to the National Suicide Prevention Lifeline Designation Act? Dr. McKeon, what do you think?
Well, I remember having a conversation with Steve in which he talked about this idea. It was at a state Utah suicide prevention conference. And if I remember correctly, it was like November or December of 2016. And he had already determined that it could not be done by just for Utah. It had to be done nationally. So I'm going to say it was before that. I'm going to say January 2016.
Wow. Okay. So I certainly didn't anticipate Dr. McKeon going back that far. January 2016. Now, just for the Crisis Jam audience, so we know the rules. If Richard nails the month dead on, then nobody wins but Richard. But you have an opportunity in the audience to get this right. Either was it more recent than that, over, or before that, under January of 2016. So we'll give the audience a second. While the audience is voting, Steve, give a little bit of the story, but don't give the answer yet.
Okay. So we tried to get a 3-digit number here in Utah for crisis services. We failed. We failed 2 years in a row. So it's kind of like we didn't make the high school team. So we said, let's try out for the NBA. And we then went to Senator Hatch and Congressman Chris Stewart and said, will you please run a bill in Congress to do that? We, in preparation for that, ran a resolution here in Utah that I sponsored that passed unanimously. That for me was kind of that seed date.
Yeah. So what's our audience think? Over or under? What's it look like? So 68% are saying it was earlier than January 2016. What do you have as the answer, Steve?
There's probably not one right answer, but it was March of 2017 that Utah passed the resolution unanimously saying, Congress, please create a 3-digit number nationwide. And then it was our delegation that took up that charge and got the first bill running.
Yeah. So, Steve, what does this facility mean to you?
Well, about 2.5 years ago, David, as you know, Hope had a new number. Now, Hope has a new location. And you've seen what a beautiful facility it is. We have these across the state. We think this is the crown jewel of the state and maybe the nation. But this is the safe place to come after someone to visit and someone to call. And so we're calling the whole area here the campus of hope, because that's what it symbolizes, is hope.
Yeah, it's a terrific game changer in terms of setting an inspiration for communities around the country. Dr. Richard McKeon, question, comment, reflection as you listened and as you've seen this facility today.
Well, I have a comment and a question. So my comment is that I think it's important for folks to realize that Steve is probably the single most essential person in the creation of 988, because without him, it would not have moved from an idea of advocates in Utah to coming to the national stage, engaging the Utah congressional delegation, and having the National Suicide Hotline Improvement Act first signed by President Trump. And then after that, the National Suicide Hotline Designation Act signed by President Trump in October of 2016. Of 2020 rather. So I think his contribution has been enormous. My question for you, Steve, is as somebody who's clearly been a visionary leader in suicide prevention and crisis services and behavioral health, what do you see as the most important, either in Utah or nationally, next step for us all?
Well, let's start walking the stairs.
Before we do, can I
Oh,
point something
yes.
out real quick?
So, Richard, I'm going to hold all those thoughts and come back. Steve hasn't heard them. So tell us about the ceiling, and then we'll go to Richard's comment and question.
Yeah, so part of the purposeful design is that when patients walk in, the ceiling is undulated, it's wavy, it's crooked, but as it moves forward, it begins to straighten out.
Yeah.
And that we hope that's a metaphor for
A road to recovery.
Road to recovery, absolutely. Yeah.
So Steve, Richard was giving you an enormous amount of credit for moving the idea from a scene, from an idea to an actual reality nationwide. And, you know, I think it's important to you're a Republican. This has been an enormously collaborative, bipartisan effort from the get-go.
Yes, I like to say that it's bipartisan, it's nonpartisan. It's survival of the human race. And interestingly, the resolution we passed create to 3-digit number at the national level, that was unanimous. And then when Congressman Stewart and Senator Hatch passed the first bill in Congress, it was unanimous, both in the House and Senate, minus one vote. There's always one, right?
There's always one.
I don't think that's just the Congress, I don't know. They shouldn't be. So it's been extremely bipartisan the whole way through. And about the 70 mental health bills we passed here in Utah, they're almost always unanimous, ordinary unanimous. It's something we can all agree on.
So the other thing Richard talked about was, given everything we're talking about, both for Utah and nationwide, what do you think is the most important next step for us to keep this work going and for crisis care to be available to people in a way that feels like care to them, and that those barriers to access are gone? So what do you see as the most important vital next step?
So I'll give a quick example. I was on a plane recently and I was going to present on some mental health bills we passed, and the couple next to me, he was a doctor and she was a teacher. And they said, "What are you doing?" I'm like, "I'm going to do this presentation." Like, "Give it to us." So I did. And I said, "You've heard of 988, right?" They said, "No." And I'm like, So I think awareness, continued publicity. We know that awareness has gone up a lot faster than it did with 911.
Right.
But people need to know these resources are available. I was out with an MCOT team last week, and they asked the patient, "Have you heard of 988? And he said, "No."
But he actually said more than that.
Well, we're not going to go into it. So publicity, but continuing to build the facilities out. We now have, I think, 7 or 8 of these facilities in Utah. We're continuing to expand MCOT teams. This session just finished. I got passed a bill to increase reimbursement rates for peers and for MCOT teams. So keeping our eye on the financial part of it is going to be key to sustainability.
We didn't have a lot of time to talk about the payment structure, but we're going to do more in Crisis Jam on that topic. Kevin, what would you like to leave us with, your hopes and dreams for this facility as you launch here in 2 weeks?
Well, we always saw this as an opportunity to do it better here, but also we feel this is a very powerful message to the world. You can do this work better. You can do it more human. You can do it with respect and dignity. And so we want what we're doing to be the start of something that's not just about Utah, not just about here. It's about doing this better for our communities.
So there was a vision in the 80s of a facility that would be available for law enforcement drop-off, and to see it, see the facility, see the flow, see the care and the engagement, the warm blankets, terrific, terrific. So thanks so much for joining us for our first live and on location event. We hope to do more as we go forward and highlight other programs throughout the country. But join us next week with a fireside chat with Dr. Chris Carson, one of the innovators of the No Wrong Door, and Dr. Morgan Shields the week after about inpatient psychiatry and its effectiveness. So thanks for being here. We're going to go out the door with some drone footage showing you this incredible facility, the Kim and Carolyn Gardner Crisis Care, the Campus of Hope.
Campus of Hope.
For Salt Lake City, Utah. Thanks to Kevin Curtis, Representative Steve Ellison, David Huntsman, Chief Croyle, Heidi, Sydney, who am I missing?
Claudine.
Claudine. Thanks to everyone. And thanks to all of you in the Crisis Jam community for joining us.